Everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. In today's video, we're going to be discussing a medication known as Flurbiprofen. Its brand name is Ansaid. Now, before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. Now, during this presentation, we'll discuss the mechanism of action or how this medication works, indications or reasons we would prescribe this medication to a patient, followed by contraindications or reasons we would not be able to prescribe Flurbiprofen. We'll then talk about some examples of dosing, and then finish it off with side effects. I put together some slides to go over this information. Let's jump right into it. So the first thing to discuss here would be the mechanism of action, or how this medication works. So Flurbiprofen is a phenylalkanoic acid derivative, NSAID, or non-steroidal anti-inflammatory drug. It has anti-pain, anti-inflammatory, and anti-fever effects. It works by inhibiting prostaglandin synthesis by inhibiting COX-1 and COX-2. In terms of indications or reasons we would prescribe this medication to a patient, well, we would most often see this medication used in the treatment of osteoarthritis or rheumatoid arthritis, although there is some off-label dosing with this medication as well. With respect to contraindications or reasons we would not be able to prescribe Flurbiprofen, well, we wouldn't give this medication to a patient who had a hypersensitivity to Flurbiprofen or to any other component of the formulation. As well, if a patient had asthma, urticaria, or allergic type reactions after taking aspirin or other NSAIDs, then they'd also not use this medication because anaphylaxis has been reported in these situations. Now for some examples of dosing with Flurbiprofen. So in the treatment of osteoarthritis, we may see 200 to 300 milligrams per day orally given in 2 to 4 divided doses. The maximum dose would be 100 milligrams per single dose and 300 milligrams per day. In ankylosing spondylitis, which would be an off-label indication for this medication, we may see 150 to 300 milligrams orally daily. If somebody was using Flurbiprofen for dental pain, we may see 50 milligrams orally every 4 to 6 hours as needed. As with all medications, there are some side effects or adverse reactions that patients may experience while using Flurbiprofen. We'll go over some of those here now. Some patients may experience abdominal pain, constipation or diarrhea, flatulence and heartburn may occur, as well as indigestion or nausea. Some patients may experience an increase on their liver function test, a headache, or urinary tract infectious diseases. The more serious side effects would be body fluid retention, edema, hypertension or high blood pressure, as well as hyperkalemia, or an increase in someone's potassium. Alright everybody, that's all we're going to talk about today with Flurbiprofen or Ansaid. As always, I'm very thankful you took the time to go by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, remember you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. And there's also some links in the description you can check out as well. So for today, take care.